If you practice long enough, you're going to have difficult patients, and most of us have difficult patients on a daily basis. And these are not necessarily patients that have the most difficult medical condition that you're seeing them for, or they want the most difficult cosmetic procedures. A lot of times it's really about managing personalities and managing your practice. So one of the most common complaints that patients give me is my wait time. So in order to diffuse the situation, I think it's really important to know how late it is that you're running. If you're running 10 minutes, 20 minutes, half hour, hour. So what I do if I know I'm running more than, let's say, 10 minutes behind, I always walk in the room and say, hey, I'm sorry I kept you waiting today. I know your time is valuable. We just fell behind because we had some difficult patients that needed a little bit extra time. And I think that really just diffuses the situation because you acknowledge the fact that the patient's time is as valuable as your time, and you are truly remorseful for the fact that they've had to wait for you for a long time in order to be seen. And I think especially the patients who have something really simple, like a refill of their acne medication, a refill of their eczema medication, when they're going to have just a 5-minute appointment, if they've waited for an hour to see you for 5 minutes, they're really going to be upset. So you really need to make sure that you apologize. And I always say, we're going to try to do better next time so we don't have to keep you waiting as long. And I think that really diffuses the situation. So I think that it's just really important in general terms, just be honest with your patients. You're running late, just say, I'm sorry I'm running late. Let's say one of your front desk people is sick. Just say, listen, I'm sorry, one of my front desk people is sick. We're a little bit short-staffed today. That's the reason you have to wait so long. And most people understand that you can't have everything perfectly every time, but as long as we try to do better the next time, I think they're going to be satisfied with that. I think more and more we're encountering patients that have insurances that don't pay for lots of things that they want done. I think the most common example in my practice, when a patient comes in, they have 20 skin tags around their neck and their axilla or groin, and you say, I know these are benign, they're nothing to worry about, and I understand that you don't like the way they look or they may be irritating, but really this is a non-covered cosmetic procedure. And the line that I always get from patients is that my other doctor used to do this. The doctor I saw a year ago used to do this. So I always tell patients, well, you're welcome to go and see your old physician if they're still practicing, that's fine. But right now, I know for a fact that this is not going to be covered. And in reality, I think that dermatology is facing a challenge because a lot of the things that we do may on the surface be considered cosmetic. So whenever I do something that maybe some insurance companies may consider cosmetic, like removing an irritated seborrheic keratosis, removing an irritated skin tag, I always tell patients there's a good possibility that this is not going to be covered and it's going to be deemed a cosmetic procedure, and you may get a bill for this service. So I think if patients know this from the beginning, it's a lot easier to go into the conversation of non-covered services. I think the condition where sort of non-covered services come up the most in my practice is acne. Patient comes in comedonal acne, you clear them up with some topicals, and then they have persistent erythema and maybe some post-inflammatory hyperpigmentation. In their mind, it still may be part of their acne, but in their insurance mind, this is strictly cosmetic. And let's say you've tried some topicals and they're still not better. Well, now you have to talk about peels, lasers, etc. So you have to explain to the patients that your insurance considers treating inflammatory papules, pustules, comedones with topicals or oral agents as medical treatment, but everything else is considered cosmetic. So just setting those expectations from the beginning is important. So when I see an acne patient who already has some acne scarring, some pigmentation, some erythema, and I think they're going to need a pulse dye laser or fractionated resurfacing or peels, I say that from the beginning, that listen, the insurance may cover this treatment, so we're going to get your comedones, your papules, and pustules better, but everything that's sort of residual is going to be outside of your insurance. And if you want to do it, great, we can talk about it. If you don't want to do it, that's fine too. But as long as they know those expectations, I think that's going to really help to have the patients in the right mindset and have the patients have the right expectations. I think one of the most difficult things is to talk to patients who have a skin cancer diagnosis, and I also think it's difficult to talk to patients who have a chronic condition diagnosis. So let's take a skin cancer first. Let's say you diagnose somebody with a melanoma. So if you're calling somebody and saying, hey, you got melanoma, you got to go see this oncologist and the surgeon, you're going to have surgery, and you're off the phone in 30 seconds, I think patients are going to have a lot of anxiety, a lot of questions. So what I usually try to do is, if I think something is a melanoma from the time that I'm seeing them in the office before I've even done the biopsy, I always say, listen, there's a chance that this may be a malignancy. We're going to talk on the phone. We're going to work through the steps we need to do in order to get you better. I'm going to set you up with all the appointments to the right doctors just so that you can get the care that you need. And if they have, let's say you're calling somebody and they have a diagnosis of a melanoma, I think it's very important to have the percentages with their survival rate in mind. Because patients are going to ask, Doc, am I going to live or die? I know the melanoma is bad. How bad is mine? So I think it's important that you can quote them. But I always want to give them hope. I always want to say, listen, there are new medications available. I'm going to set you up with the best medical oncologist that I know. I'm going to set you up with the best surgical oncologist that I know. And we're going to work as a team in order to get you better. So we're going to try to do everything that we can in order for you to get better, in order to really keep you alive. So I think that's one encounter. The other encounter that I think sometimes is difficult is to tell a patient they have a chronic condition. So the one that I see the most for this is psoriasis. Somebody comes in, they have a new psoriasis onset. The first question is, why now? They're in their 20s, they're in their 50s. Why did I get it now? I haven't had this for 55 years. I'm 55 years old. Why did I get it now? Well, you have to explain to them that the distribution of onset is such that when you're 50, it's actually a common time to get psoriasis. And then they want to know, what is it that they can do to cure their psoriasis? So it's very important to set the expectations. This is a chronic condition, and I don't call it a disease or an illness. I really call it a condition because I think in patients' mind it has different connotations. So it's a chronic condition, lots of good treatments for it, but we're not going to be able to actually cure you, but we are going to be able to make you better. So giving them hope, saying there's lots of medications that we can try in order for you to improve. We're going to work as a team, maybe with your rheumatologist, maybe with your cardiologist, to make sure that there's nothing else that's happening with you. And really having those expectations is really important for the patients. Communicating with patients is really important, as we all know. So during the visit, what I try to do is I try to sit down and really give them a chance, give the patients a chance to talk to me about what it is that bothers them. So give them a chance to review, maybe they brought some notes, or give them a chance to tell you the story about how they think their condition has occurred. And it really doesn't make a difference if I walk in and I already know they have contact dermatitis, and in my mind I already know what it is that I have to give them. I think in order to improve the patient-physician experience, it's important to sit down. It doesn't have to be for a long time, but you can sit down and say, what do you think is happening? Do you have any clues or any ideas of what it is that made your condition worse or brought it on in the first place? And I think that kind of communication really improves the overall patient experience. The thing that I try to avoid is really doing charting at the same time as I'm sort of dedicating my time to talk to the patient. So what I do is, for at least 30 seconds to a minute, I just try to sit and listen to what they have to say, kind of absorb it all in, ask them questions if there are any, and really answer their questions. The other thing that I think really can improve the patient experience is, before I leave the room, before the visit is over, I always ask them if they have any questions. Because the last thing I want to do is walk out, be in the middle of another patient exam, and have the patient say, oh my God, I forgot to ask you a question. That may happen anyway, but if you give them a chance, say, any other questions, anything else I can help you with today? They say no. In my mind, they're satisfied with their visit, and the visit is sort of over. So if they have any questions, they can come back or they can call you on the phone. So I think listening to patients and really asking them if there's anything else that you can do for them is very, very important. Now, we all have those patients that come in with a laundry list of things that they want to do at the same visit. So I think it's really important that the patients understand why they're there and that your time is limited, and you can't spend an hour with a patient going over every single mole or every single skin tag or seborrheic keratosis that they have. So I think it's really important to set those expectations. So if somebody comes in, let's say, for a full body check, what I really try to do is I try to focus on looking at all their spots, and let's say they have a question about their seborrheic dermatitis, psoriasis, eczema, cosmetic procedures. If it's really just becomes too much, I always say, listen, I'm sorry, I have lots of patients waiting and their time is important. I know you've come today for a visit, and I'm sorry if I can't answer all your questions, but I promise you, if you can come back in 2 weeks, a month, whatever it is that's good for you, we can spend more time going through your list. The other thing that I think is helpful, if somebody does have a list, I always take it from the patient. I ask them if I could see the list and just read through it and make sure that I say, I'm going to go through every one of these spots that you've marked on there, because when we do your head-to-toe exam, we're going to look at all those spots. So we don't need to go over each of them individually, because I'm going to look at every single spot that you have. And I think that gives patients a little bit of comfort that you're not going to miss something that's on their back or on their flank or on their leg or arm. So they really understand that you're going to look at everything that they have to look. But I think sometimes you have to just put a stop to it and say, listen, I'm sorry, I have other patients waiting. So if you have other questions, I really want you to reschedule, and we can have more time to spend together and answer those questions. And I think most people, if they're reasonable, understand that you can't be there for an hour answering all their questions, and it's okay for them to schedule another follow-up appointment. In conclusion, we all have difficult patients that we see on a daily basis. I think it's important to be honest with those patients and set the right expectations so that they have a good experience, or as good of an experience as they can, and you can move on with your day and take care of other patients that you have in the office.